And so it's got 4 prongs.
Yeah.
And let's slide. So this muscle, your 4 muscles were tight across here like this. This is in there like that. And what I see under tissue are these 4 prongs protruding. So it's under the skin. And what happens is they really cause a lot of torque in the eye socket. Now there's still some edema in there. The edema that you have is not abnormal. The edema you have is normal. When they take your eye out, did you see a video on eye removal on the internet? They have them. Anyway, they take these 2 things that look like forks and they stretch them across and tape them down. That pulls all your skin or your eyelids away from your globe. And then they take and locate the 6 muscles that move your eye and they cut those off and then they tag each one of those. And they have this thing that I think it's called a gelling spoon. And it looks like a spoon with a little tiny pair of scissors on the back, and they run that down the back of your orbit, clip your optic nerve. It holds your optic nerve so that they can check it, and then they put that back down, then they put an implant in, they tie those 4 muscles back across, they don't use all 6, they tie 4 across, and then they push it into the eye socket, and then they close that with, push that into the tissue and close the tissue, then they stretch the conjunctiva across and close conjunctiva. And that's all they do. Really simple.
What happens to the muscles they don't use around to?
You have 2 muscles. One of them runs through a piece of bone and one other one runs through a piece of cartilage. And they don't use them because what would happen is if they used them, of course they've had to stretch them, they're not attached to the globe anymore, and the globe is soft and the implant is hard. When you'd smile, the eye would look way up in the air. So they choose not to use the non-primary muscles.
Right. Makes sense.
Yeah, you're going to have pretty good motion. Again, there's a little edema in there. Your eye socket looks really, really good, but we'll be seeing you for the next 6 months, every other month, or every 2 months. So I'll see you 2 months from now, and then 2 months from then, and then all of that tissue and stuff is going to draw back and get tighter. We'll end up having to make the eye bigger, probably. There's now I don't know if your parents know or if what website you went to on the internet, but the primary reason you wear a prosthesis is not so that you look good. That's a benefit of it. An artificial eye's primary function is to replace volume deficiency. And when you have volume deficiency in the orbit, if we don't keep that eye growing as you grow, or keep that eye growing as you grow, that's a good analogy, I guess. What happens is instead of the eye socket, or the eye fitting the eye socket will eventually fit whatever is in there. Like that conformer will eventually shrink and fit around that. But what causes, the bad side of that is that your bones start to atrophy. Now the doctor put an implant in, so that's going to stimulate some, and the eye itself stimulates some. Our goal is to cause enough stimulation to stop any orbital bone loss. I'll paint myself here in a second so you can see what I'm talking about. I'm trying to give you education here. Hold up. You hold. Thank you, sir. Cold water won't hurt. It's going to go cold. Like refrigerator, doesn't it? Should be soothing. The other reason you wear an eye, besides is to keep the tissue inside the orbit healthy. Again, so now there's 2 reasons. So we're going to keep bone health important, tissue health important, and functionality. We want your eye to function the best it can. It's tearing, moving, all of those things.
Oh, it is.
Pardon?
I said, it does tear. Oh, I'll step straight.
Little clear thing back. Yay! Down on the floor, up the ceiling. Thank you, sir. And that is the worst part of today. That's not that bad, was it?
Nope, not at all.
Now, what did you mean by he has edema in there? What is that?
Swelling. It's just.
Oh.
Like I said, they pull everything forward.
Right.
And it takes about 6 months. The surgery, the suture line is healed. But everything hasn't settled back and got tight yet.
Okay.
It takes about 6 months. Young kids a little faster than that. They just heal fast.